Kenya's health system is in the grip of a severe crisis triggered by deep budget cuts, the freezing of key US aid programs, and widespread institutional and systematic failures. From disrupted HIV treatment to critical contraceptive shortages and underfunded public hospitals, the situation is placing millions of lives at risk across the country. One of the most immediate impacts has been felt by Kenya's HIV response. Following a suspension of funds from the US President's Emergency Plan for AIDS Relief, over 1.4 million Kenyans living with HIV are facing potential drug shortages. Essential ARV shipments remain stranded in warehouses due to a dispute over distribution and funding accountability. We are down to 6 months of ARV supply, said a Ministry of Health official who requested anonymity. We are urging donors and government partners to resolve this urgently. In addition, the destruction of 9.7 million worth of US funded contraceptives, including implants and emergency pills, has sparked outrage among public health advocates. The action carried out in adherence to a now defunct US policy opposing support for NGOs that offer abortion referrals has left an estimated 108,000 women without access to long-term birth control options. At the domestic level, the Kenyan government's budget allocation for health has plummeted, despite the Ministry of Health requesting 426.8 billion Kenya shillings for the 2025-2026 financial year. Only 105.4 billion was approved, a staggering 161 billion funding gap. Key national programs are now underfunded, including the Social Health Insurance Fund, short by 145 billion Kenya shillings, the Primary Healthcare Fund, short by 48 billion Kenya shillings, the Emergency and Critical Illness Fund, short by 97 billion Kenya shillings. Additionally, vaccine procurement, community health outreach, and specialized care in referral hospitals are all facing significant shortfalls, severely limiting the country's ability to deliver basic and emergency care. In October 2024, the government replaced the National Health Insurance Fund (NHIF) with Social Health Authority (SHA), a move intended to streamline health financing. However, the rollout has been marred by controversy. While over 19 million Kenyans have registered, fewer than 3.3 million are actively contributing to the new scheme. Meanwhile, SHA's access to citizens' personal financial data, including mobile money and tax records, has sparked privacy concerns. Allegations of mismanagement and forced vendor kickbacks have further eroded public trust. Kenya's human resource crisis in health has intensified. Delays in paying intern doctors and widespread layoff following donor cuts have left hospitals understaffed and overstretched. Interns, who make up about 30% of public doctors, have staged walkouts, citing mental health strain and unsustainable workload. Tragically, several trainee doctors have reportedly died by suicide, draining attention to the urgent need for better support system and timely remuneration. Adding to the burden, Kenya is now witnessing a sharp rise in non-communicable diseases, which account for nearly 39% of annual deaths. Health officials are grappling with a dual crisis: malnutrition on one end and obesity-linked conditions like diabetes and hypertension on the other. Cultural norms that associate with wealth remain a barrier to progress, even as public awareness campaigns attempt to change perceptions. With both foreign aid and domestic funding in decline, Kenya's vision of achieving universal health coverage by 2030 is in jeopardy. Health economists warn that without immediate policy interventions, donor engagement, and transparent reforms, the country may face a full-scale public health emergency. It's not just a budget issue, it's a matter of lives, said Dr. Miriam Nyongesa, a Nairobi-based public health expert. If the health sector collapses, everything else follows.